Boils can be contagious. They can also be recurrent, meaning they occur every now and then. They can be small or even large, and they can appear in private parts, but basically anywhere in the body. Like, for example, this is a sty that's happening on the eyelid. Now, they are different from pimples and cysts, which usually form from acne, and they have a habit of forming in some very embarrassing areas. Like, for example, I remember in primary school, I had a friend who had a boil on his buttock. So sitting down would be an issue. Even lying on their back will be an issue. In this video, we're going to see what boils are, what usually causes them, and how you can tell the difference between the boils and pimples that usually form from acne, the pimples and cysts that usually form from acne, and how they can be treated either in the hospital or just using home remedies that actually usually work. Now, what are boils? Now, boils are usually contagious skin infections that start in the hair follicle. Now you see, you have the hair and you have the root of the hair. So it usually starts in the hair follicle or the oil gland, and at first the skin turns red in the area of the infection, and there will be a formation of a tender lump that usually developed after, let's say, 4 to 7 days, and the lumps start turning white as the pus start forming, and mostly the pus will form almost at the center, and it collects under the skin. It's usually caused by Staphylococcus bacteria, Staphylococcus aureus. It's mostly on your skin all the time, but this can also be caused by other bacteria, so long as they are going to form that inflammation inside the hair follicle, and then the inflammation happens there, then you get the pus, then you are going to also have the boil. Now, carbuncles are usually formed when multiple boils cluster together to form an area of infection. Carbuncles can be a little bit more serious in that they cause deeper and more severe infections, and they are more likely going to leave a scar. Now let's go to the symptoms. It usually starts as a tender or a swollen red bump on your skin that can harden, or even it can start as a hardened bump. Now, when you feel that between your index finger and the thumb, when you feel in between them, you're going to feel a lump which is hard, that is inside. And over time, it becomes painful because of the inflammation. The area becomes a little bit more sensitive, and it starts itching. And when you press it, it's very painful. Now, over time, it fills with pus because now the body will identify there's an infection somewhere, and then it's going to send the immune cells there, and they're going to start what we call inflammation. And from the inflammation, that's where you're going to form the pus. And it usually forms after you get the infection from 4 to 7 days. Around that point, that's when you're going to form the pus. The boils can grow in size, meaning they start small and then they start becoming larger and larger with the time. And sometimes they can be slow, and in other times they can be a little bit more sudden. But then they are faster, they form faster than the cysts that usually form from acne. Now it has a yellow or a white center, similar to that of a pimple, and the skin around it can be red or just shiny. And the yellow part is because of the pus that is being formed, and it mostly forms on the center of the whole of that lesion that forms from the boil. Now the center where you have the pus, the yellow part, may break over time, and this is when you start getting the weeping. And the weeping is now the fluid, the pus coming out of that boil. Now it can also crust over time because now after weeping, it's going to dry off, and this is what will form the crust. Now the bad side is if you break it early enough, it can spread to other areas because, like we said, this is a contagious infection. So it can spread to other areas. So in case you have a boil, it's good to just let the immunity just work on it, or maybe if you have if you can access antibiotics, or if you can see a doctor, then you get the antibiotics, they kill the bacteria, and when this thing is breaking, by the time you don't have active bacteria, they can infect other areas. Also, it can reoccur, meaning it can happen over and over again, depending on the strain of the bacteria that you have. Remember, we have so many strains of Staphylococcus aureus that are resistant. Like, for example, we'll have medicine-resistant Staphylococcus aureus, which is one of the most notorious one. And it usually never goes because most of the drugs we usually use to treat this, they are resistant to that. So they keep coming back every now and then. Now, what are the common locations where you're mostly going to find that location? Now, where you have hair, or where you usually sweat, or where rubbing can occur, where you have that high friction, you're most likely going to have an infection there. Now, like for example, you have the groin area, and they can affect the skin folds of the groin, the pubic area, and the lips, and the folds of the vagina. This area has a lot of hair follicles, and it can be prone to high friction, the rubbing. Now, especially if you're wearing tight-fitting clothes, or just through shaving. When you shave, you might injure some parts of the skin, and this will give the bacteria an opportunity to get in. Now, like I said, it lives on the skin, and in case it gets an opportunity to get inside your skin, I'll give you an example. When you go to, or maybe when you remove the cuticle around where you have the nails, that infection or that bacteria can find a route inside, and this is what usually causes that infection that you usually get there. Also, waxing can cause this because, you know, when you're waxing, you are uprooting the hair from the root. Now you are creating some injuries, and because there is an entry where that bacteria can go through. Once it gets inside there, it establishes an infection. And we have ingrown hair. The hair might force its way out, meaning that it's going to try to lift the skin out, and this is where you're going to get that infection. You can also get boils in the buttocks, and mostly this is because of the hair follicles, the sweat, the friction in the area, and also sometimes hygiene can play a part here, because if you're prone to getting the infection and you're not hygienic enough, you're going to keep the bacteria around long enough so that when you have a break on your skin, it can be able to enter easily. Now, you can also even have boils on your face. And if you have noted, most of the areas where boils usually occur, we have so many oil glands. So like the face, the back of your neck here, the shoulders, also the buttocks. Buttocks usually don't have a lot of oil glands, but they are prone to getting them because of the fact that you have those hair follicles, the frictions, and all those. Now, on the face, it can be hard to tell the difference between a cyst, that is a cyst coming from acne, or maybe a pimple from the boil. Now, the main difference here is the boil will have pus, and they are a little bit bigger and they grow faster, and they are painful. They are more painful. But for a cyst or the pimples, most of them are usually just filled with fluid. They are not contagious like the boils. Boils can move from one place to another, and you can transfer this to other people. But cysts and the pimples cannot be transferred from one person to another. They cannot be transmitted because most of them are usually due to acne. You can also get boils on the eyelids, and this is what we usually call the styes. We treat it like any other boil because it's a boil, just only happening on the eyelid. So your doctor, or maybe in case okay, it can disappear on itself, but in case it's stubborn or maybe recurring, your doctor can give you eye drops that contain antibiotics that can help in removing that lesion there. Now, we have other areas, like we have the breasts, under the breast, in the armpits, shoulders, the legs, and we have several factors that can lead you to getting the infection. We have obesity, and also we have other skin disorders like acne, eczema, psoriasis, anything that usually creates a disorder on the skin that can break the barrier on top can give you those things, because once the bacteria gets inside, it establishes. Also, some of the practices we usually do, like waxing and also clean shaving. Trimming can be good if you are prone to getting those infections. Waxing is good, yes, but it can damage the structure of your skin and exposes you to getting that infection. Now, we have diabetes, which can make harder for your body to fight infection. Now, your body actually knows, and that's why you usually get the information. Your body knows this is Staphylococcus aureus. It's not supposed to get inside the flesh. It's supposed to be on the skin surface. So your body knows how to fight it. So if you have good immunity, it can keep it in check before it even grows. But we have medicine resistance and other bacteria that are resistant to some antibiotics that can also establish, even if you have intact immunity, they can still be able to get inside. We have other conditions like weakened immune system, like for example, when you have HIV, that's causing you to be immunocompromised. You have cancers, and maybe you're undergoing cancer therapy. They can lower the immunity. And also we have transplants. When you are having a transplant, for example, you have a kidney transplant, sometimes you're given drugs that will lower how well your immunity works so that it doesn't fight off the organs. So it can lower your immunity, and some of the infections like this one can take advantage. Now, we have other skin conditions that breaks your skin protective barrier. We also have contact with people with boils. So like we said, it's contagious. We have poor hygiene. That's, I think, self-explanatory. Also, we have poor nutrition. If your nutrition is not okay, you're not going to have good immunity. Like for example, if you have under intake of vitamin C, it means that at some point you're going to struggle with your immunity. Diagnosis. How do we know that you have that infection? One, straightforward, just observation. I can look at it and see this is acne, or I can just look at it and know this is a boil. Another thing that can be done, fluid from it can be taken out, now the pus, and taken to the laboratory where several tests can be done, one of which is gram staining. Now after gram staining, I can tell the actual bacteria causing that infection, and this is how I'll know that this will be the best drug for that. And also, if you are not using antibiotics, we can do a culture on the same pus. So the pus can tell me what exactly is the bacteria causing that infection, and the drugs that it is already resistant to, that can be very helpful, especially when it comes to those people who usually get recurrent infection. So from there, I can also know which is the best drug to give. So from the laboratory report, so your doctor will just take the swab or the pus to the laboratory. After the culture, the report will come with even the drugs. Now that you know all that, how do we treat them? Now, you can go to a hospital in case they are troublesome, but most of the time, trust me, you don't need to go to a hospital. We have home remedies or things you can do at home to make them more comfortable, or you just sit down and wait, so long as you are not going to poke them. Don't break them. Just wait until they break themselves. Now, we have several things that we're going to see when it comes to the home remedies that you can do to speeden up this thing. Now, when you go to a hospital, the draining and dressing can be done. Now, your doctor will give you antibiotics, and they're going to drain them, especially if they are large or they're big enough. And they're just going to use a scalpel and then poke and remove everything and clean everything, and you're given a dressing that will make sure that that bacteria is killed. And also they can give you antiseptics to dress the wound every now and then until it disappears. This mostly usually happen when you have an issue when it comes to the carbuncles. Now those that usually form several of the boils in the same place, when they are large or they are big or they are not disappearing, that's when your doctor will come in. Now, there are so many antibiotics that can be able to treat this. I'm not saying this for you, or yes, I'm going to mention them, but don't treat yourself. It's always good to go to a hospital where a person who knows better how to deal with them can be able to give you the best drug and even treat them, because now you can drug yourself or maybe you just give yourself a dose that will make it more resistant. For the antibiotics, I'm going to mention those which are usually very common, like amoxicillin, we have ampicillin, we have ceftriaxone, we have cephalexin, doxycycline, we have erythromycin, trying to remember, yeah, tetracycline. Actually, that one, it's mostly majorly used, especially when it comes to the Staphylococcus aureus infection. So tetracycline is one of the, okay, I'm not going to say it's the best, but it's highly prone to the resistance from this bacteria, but it's one of the most effective ones. Now, home remedies. You have this boil, what do you do? Now, you might be able to treat them at home, like I said. But whatever you do, always make sure you don't pick them, don't poke them, and don't drain them yourself. So the boil may drain on its own, which is important in the healing process. So like we said, they're going to have that infection that will be deep inside, and after some times it's going to form that pus that will form at the middle, and then after that then it will break off and the pus will come out and crusting will form, and then you're going to have a scar that will just disappear over time, depending on the size. So if you're not planning to even go to a hospital, there's several things you can do. Now the first one is applying warm compress. Like for example, you soak a cloth in a warm water and then you place it on the boil gently for 10 minutes, and you can repeat this 3 to 4 times a day, and you can do this for up to 10 days. Now after those 10 days, you're going to notice that you're going to form on the boil, it's going to form a yellow center. Now this is what we call bringing a boil to a head. Now this is the head of the boil, and this is where now the draining will come from. Now what will happen over time is now the head will break, and this is where now the weeping will come from, and this is how now it heals. It must do that. Now always keep it clean. Wash it with water, and if you have antiseptic, you can use it to wash on the surface of where you have that boil, but like we said, don't poke it. You can use a cover or a bandage to help the boil heal faster. Once it breaks, then I usually encourage someone, we have several things you can use. We have diluted hydrogen peroxide, Also, we have things like povidone, which is very good when it comes to dressing the wounds. And you just place the gauze there with a povidone, and then you dress it and you give it time. So this will make sure that you're not going to have an infection being reintroduced there until everything heals up. Now, just practice good hygiene as usual to make sure that you're not having any infection where you already have that infection. You can always use painkillers to treat the discomfort in case you're having pain there. We have non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, that they're usually anti-inflammatory, so they are going to give you that comfort there. And for ibuprofen and other, it's very important for you to know the one that you usually take, because sometimes you can also be having issues in your stomach, and some of the painkillers will not be good when you take them. They can make them a little bit more worse. Now we have complications. Now after this, what can you get? We have scar. You are going to form a scar once it heals, and especially if you had a big one. But we have other complications, especially from carbon cause, and those that usually the big ones, and when they stay long without being treated. Now there's something that we call sepsis, which is, or bacteremia, which is when the blood, or when the infection gets to your bloodstream. And it gives so many bad complications, like it can get to your brains, causing like threatening problems like meningitis. And also you can have cellulitis, which is now the infection under your skin. It can spread to the spinal cord, the bones, the heart, other organs, leading to severe infection or even death. But this is on very rare occasions. We have recurrent of the boils, especially if the strain of the staphylococcus that you are having that is causing your boils is methicillin-resistant Staphylococcus aureus. This one is very stubborn, and it's mostly the one that usually causes the life-threatening things that we have mentioned above. So I hope by now you know what boils are, how you treat them, how to differentiate them. And if you gain something from this video, give us a thumbs up, and also make sure you follow us on the social media platforms that we have, and also make sure you subscribe on this channel, because I have a lot loading for you. We can extend this conversation down in the comment region, and until next time, stay healthy.